And while we're on the subject of arthritis, please welcome April Tyrrell. April had, suffered with what she thought was a cyst in her right knee, but she went in for an arthroscopy to correct her problem, and he discovered that she was, in fact, suffering from osteoarthritis. We followed her. She went to have the procedure, and here's what happened.
An arthroscopy, in the most simple terms, is the introduction of a scope, a telescope in lay terms, into a joint. And that can be anything as small as a wrist joint or anything as large as the knee joint. How are you? Are you all set for today?
Yes.
When you talk about the knee joint in particular, we're talking about either tears to the cartilage within the knee or reconstruction of the ligaments within the knee that have failed. You can see on that side, which is the inside of her knee, you see a nice wedge-shaped black area between the two bits of bone. But on this side you can see that there's a white signal within it, as well as a small lump on the outside, which correlate quite closely with the lump that she can feel. That is giving her pain. The procedure, as I described to the patients, involves making 2 incisions on the surface of the skin. One allows the introduction of the telescope for us to visualize the joint. The second allows the introduction of a probe. Now, this probe that's in there is crucial to any arthroscopic procedure. The idea being that it's acting like an extension of my finger, and you can see here that that cartilage is not normal. So the cartilage around here is nice and soft. This cartilage, you can see, has already got a hole in it with a little frayed edge, and that's all part of a very early osteoarthritic or wear and tear process. Once the probe is removed and the diagnosis confirmed, that portal is also used to introduce instruments of various sorts. The patient has a special type of what we call a horizontal cleavage tear in the meniscus, and we will use a combination of punches and a shaver to remove part of that tear, because that's what's giving the patient symptoms. Once we've done that and we've done whatever is required, we wash the joint out, remove all the debris, stitch to close the portals. I also infiltrate some local anaesthetic around both the portals and the area where we've done the procedure, because that gives the patient some relief in the short term at least. So we then apply a sterile dressing, bandage it, release the tourniquet, check that the blood flow is okay, and that's the end of the procedure. I expect her to go walking home today, and I'd expect that particularly the pain that she felt on the outside of the knee should be a lot better after this.
Well, April Tyrrell's in our audience this morning. Good morning, April.
Morning.
$64,000 question. How's the knee?
A lot less painful.
It worked, did it?
Yeah.
And what's it like watching yourself being operated on?
Very strange.
Yeah. Thank you very much for letting us follow you, April. Thank
Okay.
you. Zora, who have we got?